First of all, I want to just start by welcoming everyone who is joining us this afternoon for this very important COVID-19 town hall session. Again, this is a very important session for, I think, all of us to have in our various communities. We know that there are a lot of questions, things that we are unsure about, that we need better information and we need clarity on. And so we're hoping that this afternoon we'll be able to provide that and to answer a lot of the questions that exist in our minds. So again, we want to give as much time as possible for the sharing of information, and then of course for questions and answers so we can get to your specific situations. So we're going to try to get started right away. And the first thing we want to do, again, as this exercise is being hosted by the church, the Assembly at St. Albans, as we always do, we like to commit ourselves in prayer with any activity that we're going to undertake. So just give me one moment to open us up in a word of prayer to ask for the Lord's blessings on the activities of this afternoon, and then we will jump right in. So let's just open up. Our blessed God and Heavenly Father, we just want to give you thanks for your many blessings, for your grace, your mercy, your loving kindness toward us. We want to just acknowledge, indeed, blessed God, that you are the one who is in control of all of our circumstances, that you are sovereign, and that you would do as you will. We want to thank you for being the creator, the one who knows our frame, who knows our bodies and the intricacies thereof. We also want to give you thanks for wisdom and intelligence given to men and women to understand your creation and to be able to give help in addressing all of the things that would affect us in these bodies, all the ailments that we would experience. And we just ask that you would lead us this afternoon by your Spirit. We ask that you would give help to everyone who would share, that they would be able to present clearly, to address the issues that would be of concern to everyone who would be tuned in. We think of those who have already been affected by COVID-19, and we just ask for your continued grace and mercy towards them. And we would ask for your divine hand of protection upon those who have so far been fortunate and blessed not to have contracted the virus. And we just ask that in it all that you would just continue to come in and to give help and even attending to our various needs and our circumstances. So again, we just commit this time into thy hand. We ask for a time of blessing. We ask for a time of much help, for encouragement, and that upon the conclusion of this afternoon's activities, that everyone will go away better informed in making the decisions that they would have to make for themselves and for their families. So we just ask for your blessing upon us all, and we would ask it in the name of our Lord and Savior, Jesus Christ. Amen.
Amen.
Amen. All right, so the first thing I want to do is welcome the doctors who will be on our panel, some who may be yet to join us, but others who are already on. I'll just read a quick intro of them each. But of course, as you prepare to share, you can give your own additional information, things that we might need to know to better understand your perspective and where you're coming from with what you would be sharing. So first of all, we have with us Dr. Veronica Wiltshire. She is a board certified general pediatrician and chief medical officer at Joseph P Addabbo Family Health Center. She is in charge of clinical operations for 5 clinic sites. Dr. Wiltshire received her bachelor's of science degree from St. Francis College and her doctor of medicine degree from Ross University School of Medicine. She completed her pediatric residency program at SUNY Downstate Medical Center in Brooklyn, New York. She's passionate about community health. Her priority is to make sure that those less privileged patients who attend community clinics receive quality care. She grew up in Guyana. She's been attending the Brethren Church. She's a part of us since then. And what she's going to do for us is she's going to give a breakdown of what vaccines are, how it was produced, how it's different from other vaccines, how it was created so quickly, and how it works. And we know, of course, there are a lot of questions around that. Also joining us, Dr. Kiesha Benn is a maternal fetal medicine specialist at Northwell, Long Island Jewish Medical Center in the Department of Obstetrics, Gynecology. Dr. Benn is also an assistant professor with the Donald and Barbara Zucker School of Medicine at Hofstra, Northwell. She received her undergraduate degree from the Sophie Davis School of Biomedical Education and City University of New York, and her medical degree at SUNY Downstate Medical Center College of Medicine. Little shout out to City College. That was my place of employment for the better part of 2 decades. She will talk and answer questions about taking the vaccine while breastfeeding, or if it's safe to take while you're pregnant. Also, if it can cause infertility for those who may want to get pregnant in the future. So thank you, Dr. Benn. Again, let me just continue spotlighting all of our other panelists. And so that will be making things a little bit simpler. Excuse me. It's a little tricky scrolling through, but we'll find all of our panelists and get them up on the screen. Dr. Tola Sarumi is a licensed psychiatrist, an addiction psychiatrist at Massachusetts General or Mass General Brigham McLean Hospital, and a faculty of psychiatry at Harvard Medical School, and an emotional wellness strategist who's passionate about women's issues and overcoming the stigmas associated with mental illness. Dr. Tola is a recipient of numerous awards for her work on alcohol use disorder, physician suicide, the silent epidemic, and synthetic cannabinoid use. She has been featured in Medscape, the Canadian Medical Journal, the American Association of Publishing Leadership, the American Journal on Addiction, Health eCareers, the Washington Post, Thrive Global, and on podcast shows. She's a sought-after expert and mentor on addiction, substance use disorders, and physician suicide. You can find her online at her website, drtola.com. That's drtola.com, or strolling the streets of Boston with her husband and twin children. So as a psychiatrist, she's going to talk with us about the long-term effects of COVID-19 on the brain, the mood, the sleep, etc. I do believe that's very important, as that's one of the aspects that we tend to overlook when talking about COVID-19. So we're very happy to have her. Dr. Adrian Tyndall is the chairman of the University of Florida College of Medicine, Department of Emergency Medicine. He is also vice president for strategic and academic affairs for University of Florida. He recently served as the interim dean of the University of Florida School of Medicine. He is board certified in emergency medicine. He is also a native of Guyana, attended Bishop's High School, and has gone back to Guyana to work with the emergency medicine programs at Georgetown Hospital to develop the level of care there. He can speak about the vaccine hesitancy, why as a Black community we have such problems taking vaccines in general, and concerns about the COVID-19 vaccine. He also can talk about the patients he sees in the ER with severe cases of COVID, talk about it in general and what we can do to avoid ending up in the ER. Also joining us is Dr. Ari Benjamin, an internist, born and raised in Queens. He is the Associate Chief Medical Officer and Director of Population Health at the Joseph P Addabbo Family Health Center. Many of his patients are in the Queens area. He'll also be able to talk about diabetes, obesity, hypertension, and other chronic conditions that increase one's risk of having severe COVID-19. He can explain why he recommends his patients to get the vaccine. He can also speak from the perspective of being an African-American male and help people to understand why they can trust the vaccines. Dr. Daryl Altman is an asthma and allergy specialist who has worked at the Joseph P Addabbo Clinic for many years, takes care of the majority of the community who has asthma and allergies. She'll be able to talk and answer questions about allergies and the COVID-19 vaccine, who can or cannot take the vaccine. She'll also talk about the side effects and why it happens, and what exactly causes anaphylaxis after taking the vaccines. So that's also a very important concern that I know is on the mind of many. Dr. Kimroy Walters is a hospitalist. His residency in the New York Health and Hospitals in Harlem. He's a board certified internist working at a hospital of Southeast Health in Dothan, Alabama. And so we're happy to have him, of course, a son of St. Albans. So we're happy to have him with us as well to share with us from his experience. I'm just admitting a few more people in, and we want to, again, as I said, get started right away. Also, Dr. Chang-Soo Rim is the Director of Internal Medicine. He is an internist and works at the Joseph P Addabbo Clinic as well. I'm not sure if I see him in here as yet, but if he is, we'll bring him.
He's not able to join today.
Okay, thank you very much. And so again, just want to make sure all of our panelists are on the screen. If I'm missing anyone, I'll try to bring you up as soon as I can. With that said, what we want to do is we want to get started right away, and we want to allow our panelists, our esteemed doctors, to begin to share with us and tell us essentially what we need to know about COVID-19 as well as the vaccines. I think a lot of us think we have a good handle on what's going on. Being that it's been almost a year or maybe over a year since we've been hearing about COVID-19 and dealing with it. And so we tend to think we have gotten comfortable with it. And so we want to get an understanding of what's going on. There have been changes, there have been mutations. We understand, there are differences in the trajectory of the spread of the disease and so many other factors that really we may not have as good a picture or a handle of. And so we want to start with sort of getting a snapshot of where we are in terms of COVID-19, and then move into talking more specifically about the vaccines. And so I'll turn it over to Dr. Wiltshire to get us started, and then we'll see how we would go from there.
Hi, guys. Hello, everyone. And thank you, Gareth, for organizing this. I think we're in this time of our lives where, it's a lot of chaos, a lot of difficulty, a lot of sorrow, a lot of pain. So I think coming together with the church family and the medicine family to help, bring truth to all of this so we can all understand. Now we have the vaccine, so we want to make sure everyone get the correct information. One of the things you can probably do, Gareth, in the chat, maybe put the link up or share for the YouTube, so that way, if anyone else want to try, I don't know the capacity for the But yeah, so thank you to all the doctors who joined, and you guys, try to share this video to your family and friends on YouTube, because I know a lot of people have questions, especially about allergies and the vaccines and so on. So we have specialists on here who are going to be able to help you. So just to bring us up to date, I just wanted to give you guys just a brief statistics of what we're dealing with currently. Remember, in the whole world, we've had about 103 million cases of COVID-19 disease, and 2.2 million people have died worldwide. When we talk about the US, so far 439,000 people have died from the disease. When we talk about New York alone, New York State, it's been so far 42,996 deaths. Currently, because I know a lot of people are tuning in from Queens, and a lot of our clinics are located in Queens, so we always try to keep up to date with what's going on in the borough. So there's a 6% positivity rate. So that means that COVID disease is still well and kicking and causing infections. One particular neighborhood in Queens, which is the Richmond Hill neighborhood, zip code 11419, they actually have a 16% positivity rate. And in New York, we use public transportation a lot. So that means people are constantly coming in contact with others who have COVID disease. So that's why it's important for us to have forums like this, so we can understand exactly what's going on. So remember quickly, COVID-19 disease started in the latter part of 2019, and it's caused by the virus SARS-CoV-2. So you guys know that's a type of coronavirus, and the coronavirus has been around for decades. So that's why even if you look on your Lysol bottle, you'll see coronavirus, because it's a branch of virus, and it causes things like the common cold. So it's been around, and the only thing is that viruses mutate, and they cause different symptoms. So back in 2003, there's a kind of coronavirus that's called SARS-CoV-1 that caused a respiratory syndrome. Then in 2014, in the Middle East, there's another type of coronavirus that caused an outbreak. again, another respiratory syndrome. So now you have this mutated version called the SARS-CoV-2 that's been wreaking havoc and causing all this worldwide pandemic. But again, it's new in the sense that this particular type is new. The whole family of the virus is not new. So the thing is, we all have been watching the news, so we know the disease affects mostly the elderly and the adult population, those with underlying medical condition, heart disease, lung disease, diabetes, obesity. And we know that the virus is spread mainly through respiratory droplets. So that's why we have to wear the mask and keep our distance. So it's not like tuberculosis where it's in the air and you can just catch it just by being in the room. These are something that's preventable if you protect yourself from getting exposed to the droplets. And one way to do that is by wearing your mask and staying the distance, because if someone is talking or singing or sneezing, the droplets can go a little distant, but from what science show, usually if you're 6 feet apart, then you're pretty safe. From what we've seen also, sometimes the virus can stay on surfaces a little bit. So you also want to practice good hand hygiene to make sure you're wiping the surfaces, washing your hands frequently, so that way the droplets don't stay on your hand, and then you touch your mouth, touch your nose, because that's how the virus gets into your body. And once it gets through your body, through your nose or your mouth or your eyes, then it goes to the lungs, cause damage there, then it goes to your heart, it attacks your kidneys, and it causes a whole host of problems that you're going to hear the other adult doctors talk about. But some of the things you guys have heard so far, you've heard about the shortness of breath, fever, coughing, loss of taste and smell. And usually if someone is infected with the disease, then you have to try to isolate yourself for about 10 days. But one of the things, so we're all kind of familiar with the symptoms of COVID, but what I wanted to make sure I share with you guys today is the long-term effects of COVID-19 disease. So that's something that's called long COVID-19 or long haulers disease. So this you probably don't hear about very often. The problem with having COVID disease, you know that 80% of the people are going to get better. We know that. The 20% end up with like moderate disease, severe disease. You hear about them being intubated and so on, and you've heard about this, all the deaths around. But the thing is, catching this disease is a lot that we still don't know. But what we realized so far for the past few months, people continue to have symptoms for a very long time, and we don't know how long these things are going to last. People continue to have for many months muscle pain. They still don't have their taste and smell back. They have chronic joint pain, chronic fatigue. The virus does such a damage to the heart muscle and the lungs. In the heart, it leads to increased risk of heart failure, and in the lungs, increased problems with breathing. People who have had COVID from since in March are still having issues with coughing, shortness of breath, and that's months. They had the disease months ago. They've seen that there's an increased risk of stroke, increased risk of seizures, multiple brain problems. Then also they've seen that there's an increased blood clots. So people who've had COVID months ago are having blood vessel problems, which leads to problems with their liver and kidneys and so on. So that's what we're trying to prevent. And this is why this conversation is important. So it's not just that, well, I have COVID and I got over it. Because for some of us, we don't usually just get over it in a week or two. We have this long haulers disease. So this is why the fact that with these vaccines, we have to understand why these are important or why people pushed to get these vaccines out. And again, as a pediatrician, I just have to touch on the kids very briefly. We know COVID doesn't really kill too many kids. About 10% of all COVID cases happens in children. And out of that 10% that have COVID, you'll have about a few who would end up with what's called a multi-system inflammatory syndrome in children. So that's a serious condition that affects the heart, the lungs, and so on. And usually we see that in kids who were positive for COVID-19. The problem with this is that the kids most times end up in the ICU, and these are the ones that you hear pass away from COVID because they develop this multi-system inflammatory syndrome. So this is why, even though kids don't get severe COVID disease, when they do get it, they can risk having this this bad presentation. One other thing that I wanted to tell you guys, just to give you a brief update of the treatment, and I'm going to leave this for the adult doctors. 80% of people do get better, but the 20%, the treatments that are out now are much better. People understand more now how to treat the disease. But the thing is, the virus does such a nasty job on your lungs that some people just don't make it. The treatment that's out there, you've heard about the Regeneron that our ex-president received. Those kinds of treatment aren't accessible to everyone. So that's the kinds of problems we have. So even though something like a Regeneron treatment that's out there, in the Black and Brown communities, we're not always exposed to those treatments. So this is why we have to take care of ourselves. We have to become educated and try to use what's out there as much as possible to protect ourselves. So before we were doing the masks, we continue to do the masks. We've been doing the hand washing. We'll continue to do that. Now we have a vaccine. So let's learn about the vaccines and how it can help us, because if we get sick, we're not always privy to all the stuff that people in Washington, D.C. have. So for my family, for my friends, I want everybody to be safe. I don't want to hear that this person is dying, that person is dying. So this is why we have to understand how we can help each other. So far, and I'm just gonna talk for another 2 minutes, just overview of the vaccines that we have out now. Well, we know that the first one that came out was the Pfizer vaccine. So the Pfizer vaccine, and then they came out with the Mrna vaccine. These two vaccines are very similar. Both of them use a new technology that's called mRNA, messenger RNA. The difference is RNA. I never mentioned DNA, so that means that they have no effect on anyone's DNA. So these vaccines they went through trials. In the Pfizer study, they studied about 43,000 people, 16 years and over. In the Mrna study, they studied 30,000 people, all 18 years old and above. And what they did for these studies, they used people who represent our population in the US. And so they had people who were white, they had people who were Blacks, Asians, Hispanic. We know that in America, Blacks are a minority. The same thing in the study. The Blacks were 10% of the study. We don't expect them to be the majority of the people who were in the study, because in America, they're not the majority. So the study, the amount of people who were there, mimicked just how the population is in America. Pfizer study, for example, they didn't just study the vaccines in America. They were studying it in all different countries, in Australia, Brazil, South Africa. So it was a combination of people who were in the trial. So what the trial found was that the Pfizer vaccine is 95% effective. And so it's not 100%. So you will hear someone say, well, I took the vaccine and I still got COVID. Well, first you have to ask them, did you receive both doses of the vaccine? Because if you didn't, then you can't talk about the vaccine, because we know the vaccine has 2 dosages. For Pfizer, it's 21 days apart. For the Mrna vaccine, it's 28 days apart. And once you finish taking those 2 dosages, that's when you have the full efficacy of the vaccine. And again, no vaccine is 100% efficacious, right? So that 5% that's still left, that means that people can still catch the COVID 5% of people it doesn't work on. But from what the study showed, that even those who still end up with COVID, they didn't have severe disease. So for instance, when the Pfizer vaccine study, the 43,000 people who were in the trials, half of them received the real vaccine, half received placebo, which was just like salt water. And those people went about with their regular business. They didn't know who received what. So they didn't know whether they had the real thing or not. They went to their jobs as normal, wore their mask as normal. But guess what? The people who had the real thing, only out of that 20,000 of them, the ones who received the vaccine, only 8 of them end up with COVID. And again, they ended up with COVID because the vaccine is only 95% effective. It's never, no one said it's 100% effective. The ones who didn't receive the vaccine, guess what? 162 of them end up with COVID. So if you ask me, it looked like people who received the vaccine did better, right? And it even went on to show that the 8 people who did get the vaccine, they still had a level of protection. So the disease was not severe, which is much better. I would take a cough, a little cold, fever here and there where I don't have to end up in the hospital. So that's what the vaccine showed. And same thing for the Mrna vaccine. Those who received the vaccine, 11 of them still got the virus. But out of that 11 that got the virus, none of them developed any severe disease. The people who did not receive the vaccine, 185 of them developed COVID. So this is why these vaccines are told to us that they're effective 94-95% of the time. We have a lot of people in the world, so we need a lot of vaccines. So people came together worldwide to make as many vaccines as possible. So now you're hearing about the other vaccines that's coming out. So you heard about the Johnson & Johnson vaccines that's coming out. You heard about the AstraZeneca vaccine that's coming out. So those vaccines differ from these ones because those vaccines are going to use a virus called adenovirus to get into our system. Whereas these Moderna and Pfizer vaccines, they use the mRNA technology. So the mRNA technology, guys, you have to listen. This is nothing that's new, that just started in January. This technology has been around for at least a decade now. Scientists have been in the lab studying it. They've been working, actually, they've made a Zika vaccine out of it. They've worked on many other things, even tumor, cancer treatments, different things like that. They've been using that technology. So when they found out that coronavirus is what's causing the havoc in COVID-19, right away they went to the lab and they studied the sequence of the part of the virus that's causing the damage, which is the protein. It's called the spike protein. So they were able to, in a matter of hours, know the sequence of that protein that's causing the problem. Using that mRNA technology, they were able to come up with the idea for the vaccine. But the mRNA in itself is something that's very fragile. So they couldn't really work with it by itself. So what they did, like especially in Pfizer and Moderna, they wrapped it around in a lipid. So you'll hear something called nanolipid. They wrap it around in a lipid, and then they add all these other things to make sure that we can get the vaccine into our system. When you get injected into the vaccine, that mRNA, what it does, it goes into your cells. It doesn't go into your nucleus. It stays right outside of the nucleus, and it just gives your body a picture. It gives it a message. That's why it's called messenger RNA. It gives our body a message to make a particular protein, and that's the protein that our body is going to form an immune response to. So that way, when coronavirus tried to attack us, your body would then say, oh, I know you. I can fight you off because, you know, I was introduced already to you and I build up an immune response. So our bodies were so wonderfully made that once you tell it, you give it that picture, and it's when they introduce the mRNA, it's something foreign. So your body makes an immune response to it. They're called antibodies. So that way, if you're ever exposed to the COVID-19 virus, your body would now be able to fight it off. And that's what we want. Okay. So the mRNA does not get into your DNA. That's totally different. So you don't have to worry about your DNA changing, your nose changing, your shape of your nose changing, growing an extra leg, growing an extra head, none of that, because it's not going anywhere near your DNA. And once it does the picture and tells your body to make that protein, it disappears. So it doesn't stay around anywhere. And Dr. Benn, she's our maternal fetal medicine specialist. She's gonna come on because you hear a lot of talk that the mRNA gonna go to the placenta and affect people from becoming pregnant and so on. So I will want her to talk a little more to you guys about that. But I have the immunologist on, Dr. Altman is on. She'll talk a little more about the other vaccines that's out and the variants, because I know you guys have a lot of questions about that. But just know that the mRNA vaccines that are out, it's nothing new. It's been studied for decades now, but the problem is funding was an issue. They never had enough funding, but seeing that we're in a pandemic, people worldwide joined forces together, poured money to these scientists. Pfizer joined with a technology company called BioNTech. What a technology company doing with making vaccines. But guess what? Everybody worked together so that way we can try to end this pandemic. So yes, the vaccine was done quick, but that's because we needed to make sure we find something fast so people don't continue to die by the second. So what they did, instead of going phase 1, then phase 2, then phase 3 of the trials, all the phases were pretty much going on at the same time. So no corners were cut. They did all the regular phases, trials that go on when we're studying vaccines, but because you had so many people working together, they were able to make sure that it was done and done the right way. Again, all these things that I'm telling you is available, very transparent out there. None of the data is being hidden from the public. It's all on the CDC website. You can go there and find all of this stuff. They studied all different types of races. They studied people who have diabetes, obesity, chronic pulmonary diseases. So it was a wide array of people that tested these vaccines. Dr. Altman is going to talk more about the side effects and what happens when you take these vaccines. But all of this stuff, we know that in the past, vaccines usually take 10, 15 years, but in the past, we didn't have the kind of technology that we have now. So what I tell my patients, that I'm a Christian and I think God, wouldn't give us more than we can bear. And he brings things to us at the right time. And now we have technology that we're doing all sorts of massive things every day, with technology. Look at these kids all doing remote learning and all this stuff, all because of technology. Same thing with this vaccine. Because of technology, they were able to use this mRNA and come up with a vaccine quick. In a matter of a month, they already made the vaccine, but they had to go through trials because you have to study it on people to see how it would do. They didn't cut any corners. It's just that people came together and worked together as a team, and then people who were independent specialists, immunologists, virologists, they look at the data and decided whether these were safe or not for us, and they decided that they were safe. So Gareth, I'm gonna go ahead and shut up. There's lots of other doctors that's gonna give us some good information. And so let's see, Gareth, any questions?
So, first thing is, I want to feedback. I'm not sure where that's from. Let's see if that's still happening. So the first thing, thank you very much, Veronica. And I'm sure, as everyone can see, that was a lot of information. And that's because there's a lot to really address when it comes to this virus and the vaccines, particularly a lot of the misinformation, as well as disinformation, which is more deliberate falsehoods that are being shared about the virus and the vaccines that need to be corrected. And so it's a lot of information to come across. I think one of the most important things to realize, though, is that there is a lot of knowledge, there is a lot of information. People seem to think that, people are just guessing, or we don't know how these things work and we don't know what's going on. But the doctors, the scientists have a lot of information and, are very clear on what's happening, how the virus is working, how it's affecting our bodies, how the vaccines are going to respond, and so on. And so that's where we see, so much information is available to be shared. And quickly, I just want to remind everyone again, the chat is available, so you can type questions into the chat. If while any of our doctors are speaking, a question occurs to you, please feel free to add it into the chat and we'll make sure to relay it to them. And then when we open up for questions and answers, you also have the opportunity to ask questions then.
So Gareth, I would throw it to Dr. Tyndall, because he's an ER chief. And so he can share with the team what they're seeing in the hospital and why is it with this vaccine, all the trust issues, and what are some of the concerns.
Thank you.
Thank you very much. And I just want to say, for instance, first of all, congratulations on doing this, because this is so important.
Thank you.
Creating this kind of session for being able to direct this kind of information is really important, and really ensuring that people understand and are really educated about this, because this pandemic is something like we've never faced before. And Dr. Wiltshire, thanks for all the information that you provided up front. It's an incredible amount of information to be able to put in a small space, but it was so important, I think, and so very helpful in a number of ways. I want to touch on a couple of things Dr. Wiltshire said. I want to talk about a little bit about what we're seeing in the emergency department setting. And then I want to talk a little bit about vaccine hesitancy, because it's a big deal. And I think it has a lot to do, believe it or not, very much connected to the issues we're seeing now, especially with the variants. As Dr. Wiltshire mentioned, these vaccines especially were created really in lightning speed. I don't even want to say warp speed, but lightning speed. And this was because of the technology that's existed in the past that was quickly put to work to be able to create these vaccines, which again, the mRNA vaccines are very novel. They are new, but they have really important advantages in that they could be quickly adjusted, for instance, to create booster vaccines, especially now that we're hearing these new variants are actually out. And the fact that these vaccines can be created actually extraordinarily quickly, and they're very specific. So these mRNA vaccines are very specific to one single protein on the surface of the virus that is responsible for getting into our immune systems. And this vaccine is generated specifically to block those proteins and to literally cover those proteins and prevent the virus from getting in. A couple of things I want to say, though, about the science and the development of this, which I think is important to this audience. One is I've never seen an FDA panel so diverse in its actual the components, the people who are actually there. And the reason I say that is because typically when we think about the scientists who are involved in looking at these vaccines and really understanding safety, we tend to see a whole lot of people who necessarily are not very diverse, and usually underrepresented minorities or Black and brown folks are not necessarily on that panel. This panel was really diverse. We had a lot of scientists on there. We had a lot of Black scientists on that panel in terms of proportion. And that was really important because they were really assessing this in a very important way. Vaccines in general are safe. When we look at the benefits versus the risk, there's no question that the benefits far outweigh the risks. And I want to get into that in a little bit. But let me tell you what's going on in the emergency department. And I don't think I need to really say much about it. You've seen it all across the media. You've seen it especially in the early spring in New York. It has been a tragedy, I think, beyond measure. And I would say a tragedy that a lot of healthcare providers are still reeling from in terms of the post-traumatic stress, literally, that's actually been caused by what I would say is the devastation, but especially in our Black and Brown communities. I think what is important to understand is that this is a virus. While we may understand there are specific risk factors, it could strike anyone. And we've seen healthy people go down just as well as other people who have significant risks. I've taken care of folks my age who have been tremendously healthy, who've come down with the virus and have suffered the symptoms, and I've had to actually put on a ventilator. And I think that's the scariest thing that you can imagine, because you're in a position knowing that you could potentially catch this disease. And they look like you, and they're healthy, maybe even healthier than you, and yet they still fall for this virus. And so I think it's important to understand that that's the issue. Very early on in the pandemic, myself and a number of other deans from across the country made an impact statement in USA Today to say that our Black and Brown communities are being disproportionately affected by the virus in terms of the outcomes, in terms of infectivity and death. And now, again, we're still being disproportionately impacted because we're not receiving the amount of vaccinations or the rates of vaccinations that we should be receiving. And that's really, I think, a really important thing to understand. The third thing I'll say is in terms of treatment, and Dr. Wiltshire was right, there are other treatments that are out there beyond the vaccinations. And the monoclonal antibodies, you heard that famously a lot of people, including our former President Trump, actually got, is out there and has been used, but has not been widespread. And a matter of fact, there is a lot of angst by many at the CDC and at the federal government level that these forms of treatment have not been distributed sufficiently to hospitals and to other areas, because they prevent hospitalizations. They minimize the risk of diseases when administered to the right group of people. And so there is a significant effort to try to expand access to monoclonal antibodies, because what you want to be able to do is to prevent hospitalizations. I'm in a position in the emergency department where I don't want to see people coming in with COVID symptoms that need to be hospitalized. If there's anything I could do, is to really help to prevent a hospitalization and help to prevent severe disease. And this is where some of the monoclonal antibodies actually come in. Let me move very quickly to the issue of vaccine hesitancy, why this is such a critical topic, why educating each other about the vaccine is so important, and why taking the vaccine is very important. I was, for a lot of reasons, the second person to receive the vaccine at our hospital, UF Health. The first one was a nurse. And the reason that it was done, because in Gainesville, was one, we wanted to send the message that taking the vaccine was indeed safe. The other issue too is that, I work clinically, and the very next day I was in the emergency department taking care of COVID patients. And so I think that was also, I think, an important message. But the bottom line with the vaccine and vaccine hesitancy one is that we know over a very long period of time, there's been huge issues of trust, especially in science, involving the Black and Brown community. And I don't need to recite the history about the why. I think we all know the why this has happened over decades and decades, right? All the stories we've heard about how science has done some very cruel things to Black and Brown people. So the mistrust is there, and we understand that. Now the question is, how do we get over that mistrust to really engage people to ensure that they understand that the vaccine is indeed safe? And when I say safe, I mean that, anytime you take a new medicine or new agent or new food, there is a small amount of risk, right? There isn't the possibility of eliminating risk altogether. But when we say that the outcomes and the benefits outweigh the risks, in this kind of pandemic, when the disease could be so severe and the deaths are so high, getting the vaccine to help prevent hospitalizations and serious illness is extraordinarily important. But here's the other critical point we have to make. We've heard now that there are probably 5 major variants, wild-type variants of this vaccine that's actually out there. And I know someone was going to talk about that, so I'm not going to get into it too much. But the variants themselves, we're not sure if they cause worse disease yet, but we know that they're very contagious because they have greater affinity for certain receptors in your body that makes it a lot easier for these viruses to enter into your body. And the problem here is that the more these viruses are allowed to play in terms of infecting one additional person, the more likely these variants will actually pop up all over the place. So it's incredibly important. This is and President Biden has said this. There is no more greater mission now than try to vaccinate our entire population, because if you actually reduce the risk of catching the virus, the less cases of viruses that are out there, the less possibility a variant will actually jump out. Okay, so there is really an important reason to get vaccinated, because one more infection means that there's a chance for a variant. One of the early variants that came out, they traced it to someone who had that actual infection and had it for a very long time. And because they were fighting this infection a very long time, that virus actually evolved in that person's body. It became a variant, right? And these variants, as they pop up, 2 things will happen. They'll either become 3 things. They either become more contagious, they may develop worse disease, but there's also the possibility they will evade the immune system. They may actually make the current vaccines that are now in play not as effective. So you've already heard Moderna is trying to now redo or put a booster into their vaccines for the new variants. But the other issue, which is also important, is that even the monoclonal antibodies, there's now data to show that the monoclonal antibodies, or the antibodies that are developed when people have gotten the regular COVID-19 viruses, are now not sufficient enough to prevent disease from these other variant viruses. So all I'm trying to say with that is that these vaccines have been proven to be as safe as we could possibly create a safety profile for them. And the idea of getting vaccines into people and vaccines into arms is to ensure that we maximize the amount of people who have vaccinations and reduce the incidence of this viral infection. The quicker we're able to do that, the less likely we have variants jumping up. The converse is true. The more we allow this virus to fester, the more likely we'll see more variants and the more dangerous this becomes. So that's probably, for me, the most compelling argument to tell people that they need to be vaccinated. And we're actually spreading this message in our community in Florida, in Gainesville, and we're running clinics, and we're ensuring, going into the community, we're going into churches, and we're setting up vaccination sites, and we're educating people to ensure that we actually try to maximize vaccination and maximize immunity in our population in order to reduce the threat of this ongoing pandemic.
Thank you very much, Doctor. A couple of questions have come in the chat, and one of them I want to throw out to our panel, and it has to do with the questioning the accuracy of the tests, because I believe that's another sort of factor into leading people to think that perhaps they don't, the situation is not as severe as it is. So for people who have tested positives but don't express any symptoms, and so they start to question whether or not they were truly positive, or maybe even more broadly, we hear a lot about false positives and false negatives. Perhaps someone can speak to that. How do we get people to understand that though they may not show symptoms, that they are in fact positive and perhaps contagious as well, and so there is still a concern there, or to trust the test results, whether or not it's a positive or negative, so they don't believe it's a false result?
So I could probably start very quickly to answer the question. I'll give others who have obviously very deep knowledge of this to actually chime in. One of the things about the vaccines is that we know that it prevents illness. And in the case of the new vaccines that are coming out of Johnson & Johnson, while they're not as effective as the Moderna or the Pfizer vaccine, they clearly prevent more severe illness. What is not clear, though, is it doesn't necessarily mean you're not going to carry the virus. It just prevents you from getting ill. So it is very possible that you might test positive and you might be an asymptomatic carrier in a small percentage of cases, and you can still spread the virus, okay? And that remains a possibility in terms of a positive test. The other thing I will say, it depends upon the kind of test. There are tons of tests out there that really focus on this. And the test that's actually probably most accurate, and you probably now, everyone I've said, the whole population now become epidemiologists. You know, no one understood what PCR meant. Now everyone knows what PCR really is, right? PCR is probably the most sensitive type of test, right? So there are antigen tests out there. There are other types of tests there, but the PCR test is probably the one that's actually a much more significant. The real risk actually is not necessarily in false positives and false negatives, right? Because you might not get a good enough sample. And if you don't get a good enough sample for the nose, and now obviously now most people are doing saliva tests, you know, you may not necessarily detect the virus. It depends upon the phase of infection, because early in the infection, you might have more viruses in your, you know, in your mouth, in your nose, and obviously in your secretions. But then later on, we know that the virus actually moves down into your system and moves into your gut. And a matter of fact, you even poop out the virus, right? And so the virus may not necessarily be in high quantities of the sample at the time that you're trying to get it, depending upon the illness. And of course, if you don't get virus in the sample, you're not going to get anything positive, even though you might have had the virus. So there's a lot of intricacies on the testing that one could certainly explain. But I think the most important thing to understand is that while indeed the vaccines, some vaccines have shown it may reduce asymptomatic carriers, that's by no way foolproof. We know, and all of the studies really have focused on one endpoint, and that endpoint is, does it prevent disease? Does it prevent symptomatic disease? And that we know it does in 95% of the cases in terms of Pfizer and Moderna.
Mm-hmm. Yeah, and I think Garrett, Dr. Altman can probably add a little more to that. And, you know, because she's an immunologist, so she can tell us more about the vaccine, the different variants that's out there, you know, who should be taking the vaccine, who should not be taking the vaccine, and the side effects, because a lot of people don't want to take the vaccine because of the side effects. I see there's a concern in a question in the chat, and someone was saying that some of the nurses don't want to take the vaccines. I know some of the nurses have told me, oh, well, I don't want to get sick. So side effects is one of the issues why people don't want to take the shot. So Dr. Altman?
Hi. I was asked to address, I think the people have already spoken. Dr. Tyndall, Dr. Wiltshire have really done a nice job on a lot of the issues. So what I really like to focus on is allergy and vaccine adverse effects. Now, the entire world of vaccination, as well as infection and tumor resistance, all of this has to do with the body's immune system. The body's immune system is a multi-system focus on what is self and what is not self, what is part of your body and what is not part of your body. So we all grow up from the time of being a fetus, and our immune system knows, okay, this protein here belongs to the right person and something else doesn't. So when, let's say, a bacteria, a virus, a tumor, something enters the body that doesn't belong to you, the immune system will recognize it. And generally it will say, this is not part of this person. It doesn't belong here. I'm going to fight it off. And one of the ways it fights it off is by producing antibodies against whatever it is that the body is considered not to be part of self. For example, an infection or a virus. Now, when the immune system does this, it's like anything else. It takes work. There's a way that it goes about doing this. One of the ways is by producing antibodies. One of the ways is by producing natural body chemicals that may cause a fever, because some germs don't like high heat. So your body will increase your body's temperature in the form of a fever. It will cause inflammation, because inflammation, same kind of inflammation, if let's say you get a cut and you neglect it and it gets red and swollen, it's the same kind of inflammation that occurs in a natural body immune reaction. And part of it is to bring your immune cells into the area where there's a problem to fight off those germs. Now, as the immune system is doing this, it's causing you to have possibly some symptoms. And as a matter of fact, a lot of infections that we get, the problems from the infection don't come from the germ themselves, but actually comes from your own body's exuberant response to that infection. Some bacteria can produce their own fever. Strep can do it, but a lot of others don't. And it's your own body doing it. So when you get, let's say, a cold or you get the flu and you feel kind of run down, a lot of that has to do because your body is working very hard. Your immune system is working hard to fight this off. When you get a vaccine, it isn't any different. What's happening when you get any vaccine, including the vaccine for COVID-19, is that your body is trying to build up the proteins and the cells and the natural body chemicals that it needs to fight off that infection. So when your body is reacting to the vaccine to try and make you immune to that particular virus in this case, you may very well feel uncomfortable. Now, you may feel, of course, swelling in your arm. Somebody just stuck a needle in your arm. It's going to hurt, and it may hurt for a couple of days. You may get some swelling. You may, again, that's going to be inflammation. You may get a low-grade fever. That's part of your body working to build itself up to be able to fight off an infection. You may feel tired. You may feel sort of like you're coming down with something. And I'll tell you, I got my second vaccine last week, and the day afterward, I didn't really feel very good. I was well enough to come into work, but I felt like I was coming down with something. I took some Tylenol to feel better. I did my work, because I knew where it was coming from. So in terms of vaccine reactions, and this is particularly true for the second one, where you're more likely to get symptoms like that, I would say expect it. It's not an illness. You cannot possibly get COVID-19 disease from the vaccine for the reasons that Dr. Wiltshire described. But expect that your body's working hard. It's trying to produce this immunity for you. Give it a break, accept a little bit of fever, a little bit of feeling crummy for your day or so. It's well worth it not to get COVID. So when you get those kind of reactions, I don't consider that an adverse vaccine reaction. I consider that a normal vaccine reaction. That is your body doing its job. And sometimes it's a little uncomfortable for a day or so. So let's put those aside, because that's really a normal reaction. And particularly with the second dose of vaccine, a little over 50% of people are going to feel something uncomfortable, swollen glands in your arm, whatever it is. But let's accept it. That's part of how your body works, and it's part of how the vaccine is helping you. I want to move on to the reactions that are of more concern, that are not a normal vaccine reaction. And we're all concerned about allergies. Now, I mentioned that the purpose of the immune system is to recognize yourself from something that's not yourself from something that's harmful, that it can fight off, a germ, a virus. Sometimes it messes up. And sometimes you get an overwhelming reaction to your body's joints and you'll get arthritis, or you can get more complicated overall system reactions and you can get lupus from it, and you can get allergy. So allergy typically, in any kind of an allergic reaction, whether it be to a food, to a drug, to an immunization, generally involves redness, flushing of your skin. It could be itching, swelling, and symptoms that you might have if you have a regular seasonal allergy reaction, red eyes, runny nose. And the ones of most concern are when you get wheezing or difficulty breathing or difficulty swallowing. That's an allergic reaction. They tend to come very rapidly. Now, allergic reactions to vaccines, all vaccines, are extremely rare. And allergic reactions to COVID vaccine reactions are extremely rare. And you have to remember that when you're looking at a reaction to anything, you can't do it in a vacuum. For example, so there's been some cases of people who've got the COVID vaccine, and a couple days later, they were found to have a Bell's palsy, a temporary paralysis, a weakness on one side of their face. But you have to remember that a certain number of people are going to get Bell's palsy anyway, who didn't have a vaccine or any other thing. So if you have 100 people who get no vaccine, and maybe 2 of them are going to get a Bell's palsy that particular week, and you have another 100 people who get the vaccine and 2 of them get Bell's palsy that week, you can't blame it on the vaccine. It's some people, it was just going to happen. And there are cases like that of reactions which have nothing to do with the vaccine at all. And as a matter of fact, even with these allergic reactions, there are people who just get placebo vaccine, which is basically like salt water or water. You know, it's the equivalent, an injectable equivalent of a sugar pill, and they'll get reactions like allergies as well. So the true allergic reactions, most of them are mild and they're rare. Nobody, as of this point, and I just checked before coming on this conference call, nobody as of yet has died of an allergic reaction to COVID vaccine. Now, people say, well, what if I already have allergies? I'm concerned. I'm allergic to pollen, or I'm allergic to penicillin. I'm allergic. I had a reaction to the flu vaccine. If you have the immune system, as Dr. Tyndall explained, is very, very specific. If you have an allergy to penicillin, you're not going to have an allergy to eggs. One thing has nothing to do with the other. And the flu vaccine is very different from the COVID vaccine. As Dr. Wiltshire had explained, it's really a very clean vaccine. There's some the mRNA in it. There's some fatty substances to help get it into the cell. There are no antibiotics in it. There's no human product in it. There is no animal product in it. There are no egg in it. So if you have other allergies, you do not have to automatically say, I can't get the vaccine. Now, don't get me wrong. It's not my job to tell you to have the vaccine. It's my job to give you information so that you can make that decision on your own. But if you have if you would like to get the vaccine and you have allergies, you need not be concerned that you're more likely to have a problem than anybody else getting it. Now, again, I checked this right before coming on this call. There is only one reason, that is an absolute reason, not to get the COVID vaccine. And that is this. If you had the first dose of the COVID vaccine and you had an immediate or severe allergic reaction to that vaccine on that first dose, you should not get the second dose. But that is the only absolute reason that you should not get the COVID vaccine. So that's going to be a very small number of people with that. The other thing that I was asked to discuss was, and I think Dr. Tyndall really addressed it very well, was the idea of mutations. Mutations are changes in the genetic code. It can be a genetic code in the virus, which in this case is RNA. It can be in a human. It can be in any kind of animal or being that has a genetic code. Mutations happen. They're pretty common. And in fact, most of these mutations, which are changes in the genetic code of whatever organism we're talking about, most of them are not helpful. And many of them just destroy the organism that had that change. But as Dr. Tyndall explained, the more people that have COVID-19 disease, the more likely there's going to be for these mutations to occur. And that's just because they're there, they're going to be around. So from a population standpoint, it's really important to get as many people immunized as possible to decrease the likelihood that there's going to be mutations that can be harmful. The mutations that we have right now that are being found in COVID-19, in the coronavirus, tend to increase their ability to spread, to infect, but not necessarily to make them have more severe disease. Now, the Mrna and the Pfizer vaccine, the companies have said at this point, they feel that their vaccines do have efficacy, effectiveness against those particular strains that have been found. That could change. But again, that would mean a booster vaccine, you know, or something in additional to it to catch that particular part of it. And just one other point that I want to make, because I got this like really great picture behind me of a coronavirus. It's really pretty, but the viruses don't have any color. They are so small that light doesn't even see them, so it can't reflect. So I just wanted to mention that. But so I hope that I've given you the information you need about adverse reactions to vaccines that can help you decide if taking the vaccine is gonna be right for you.
And I just wanted a couple of questions that arose while you were speaking that, you know, I just hope you can put a sort of fine point on. In terms of the time frame for the reactions, you sort of mentioned that it would sort of be immediate upon receiving the vaccine if you were going to have a reaction, that it's something that would happen rather quickly. And so that people who are saying, well, we still have to wait and see, that really there isn't anything that they're waiting to see, that if there was an adverse reaction, they tend to happen fairly immediately. Is that correct?
Well, let me qualify that. An allergic reaction is very fast because an allergic reaction depends on these allergic antibodies that are just sitting around in your body waiting to blast off. So it's really fast. We're talking seconds or minutes. Now, if you have a tendency to have severe allergic reactions to something else, you just tell the doctor or the nurse or the provider that's administering the vaccine, everybody gets observed for 15 minutes, you may be observed for 30 minutes, because that's the time frame for these rapid severe allergic reactions. The non-allergic reactions, what I'm calling the normal vaccine reaction, that may occur the next day or the day after because they're not allergic. It's a completely different mechanism. Now let's talk about long-term effect. Mm-hmm. And we've seen to a certain extent, because during the trials and during the post-trials, when people are actually being immunized, we've had time to see if they're going to be any kind of adverse effect in the short to intermediate time frame. Whether something's going to happen 10 years from now, that really can't be predicted. We don't have any reason to expect it will. Again, partly because the immune system is so specific, but in terms of an allergic reaction, you're going to get it fast.
Thank you. There's another question also in relation to, and I think in the chat it was started to be addressed, but the natural, someone having contracted COVID and developing antibodies, should they be vaccinated? You know, a lot of people may be feeling that they've already had COVID, and so therefore there isn't a need for them to be vaccinated. Can you say something about that, the need for somebody who already may have had it and developed some natural antibodies, whether or not they should be advised to take the vaccine?
People who've had COVID are advised to take the vaccine. They are not in the group that's being told not to take it. Now, we're learning about immunity, natural immunity, native immunity to the viral infection as time passes. And one thing that's pretty clear is you can get COVID again, but not usually within the first 90 days. So the idea is whatever antibodies you have is probably protective for those 90 days. After that, all bets are off. Mm-hmm. So one of the things that is being suggested is that if you have native COVID infection, wait 90 days before getting your first dose of the vaccine. The other thing is we know what, when we give the vaccine, the mRNA vaccine, we know it's to those spikes. that help the virus actually get into the cell. When the people get the native virus, we don't necessarily know what those antibodies are reacting to on the virus. We don't know how potent they are. We don't know how an exuberant response it is. So at this point, we kind of know more about what the vaccine's specifically going to do than the native infection. So in fact, it is recommended, as much as it's recommended to anybody else, that people who have had it wait 90 days and then decide whether or not they want to have the vaccine.
If I could add to that really quickly too, and Dr. Altman is exactly correct. The other piece which I threw in the chat is that there is also emerging knowledge as to how long the natural antibody actually truly lasts, right? And I think because of that, people might think that, oh, gee, I got the vaccine, I got the disease, so I'm immune to it. Well, we don't know how long that lasts. And so it really would put people in a fairly significant risk of actually getting COVID later on. And this is especially true with the new variants that are out there that we know seem to become dominant at times. We can see that happening in South Africa, especially in the UK. So for all those reasons, taking the vaccine is really important because it's really unclear how long the natural immunity lasts. And it's also becoming very clear that natural immunity may not necessarily confer immunity to some of these other variants that are out there.
So that actually leads into a question, sorry, that's in the chat about do we have any information about how long even the immunity from the vaccine is going to last? Do we think this is going to be an annual shot like the flu? So are there any indications of how long the immunity that it's conferred by the vaccine might last?
Well, you know, we get annual vaccines for the flu, partly for a different reason, not because, partly because it doesn't necessarily last more than 6-8 months a year, but also because the flu mutates very, very quickly. And some of it's not even mutations. It's got 2 different kinds of spikes. And those spikes will, they're very promiscuous. They'll trade off spikes with each other. So that's one of the reasons why you get different flus and you need it. We don't necessarily know the coronavirus is going to do that. But in answer to the question, I really don't know. I mean, what do you think, Dr. Kendall? I mean, what is your knowledge about whether we're going to need annual boosters?
So I think the data, so you have to understand, and a friend of mine describes this as building the airplane and flying it all at the same time, right? As impossible a task that is, right? We're learning more about immunity, and we've learned much more about human immunity during this pandemic, I think, than in any other time recent. There's data, preclinical data to show that immunity to this particular vaccine, this particular viral variant could last up to a year, up to 18 months, but it is extraordinarily variable. So it is very, very unclear. What I think is becoming more apparent, though, is that as these variants begin to sort of pop up, indeed, you might see that vaccine manufacturers are beginning to retool their vaccines to come up with other variants in order to be able to have more enhancement in terms of protecting against these other sort of wild type viruses. So it remains to be seen whether or not there's going to be need for additional booster shots and who will get them. But I will say that the science is really evolving in that perspective. What is clear, though, is that we have vaccine, and the vaccine we have, we know is protective against the dominant variant of the COVID-19 vaccine, and we need to get that into people as quickly as possible, period, end of story. There's no ifs, ands, or buts.
And so Gareth, so in the chat, someone asked about who should not get the vaccine. So let's hear from Dr. Benn, who's our OBGYN maternal fetal medicine specialist. And so Dr. Benn will be able to talk to us about pregnancy, breastfeeding. Are we supposed to get the vaccines if we're pregnant or breastfeeding?
That's a wonderful question, and hello to everyone. Thank you for having me here today. So what I would like to start by saying is pregnant women Neither breastfeeding women were included in either trial, neither Mrna or Pfizer. So we do not have that information. The information is extrapolated based on science and other previous vaccines. What we do recommend, and when I say we, that's the American College of OBGYN, as well as the Society for Maternal Fetal Medicine, is assessing your risk. That's most important. What is your risk? For example, myself, I'm a frontline healthcare worker. I do ultrasound, I'm in the ICU, I'm taking care of pregnant women every day. I must work, I want to work. I'm also a breastfeeding mom. And so I had concerns just like many about getting the vaccine as well, not only just for myself, but just for my child. And I had to evaluate my risks. Number one, I'm a Black woman. Number two, I am obese. Number three, I am a frontline worker. So I fall into the high risk category. So I felt that it was very important to not only protect myself, but also protect my family. What we do know is this. We do know that the mRNA is a lipid and a lipid is a fat, and it should not enter breast milk. It should not cross the placenta, okay? So it should not come in contact with your fetus. It should not come in contact with the baby. In the event that it plausibly does cross the breast milk, the thought is that the infant would just digest it and it should not cause any problems. However, neither of these groups were studied. We do know that women have become pregnant who were in these trials since receiving both doses of the vaccine, and we haven't heard of any poor outcomes such as miscarriage. But to say that we evaluated pregnant women, we did not in either study.
I would just add in and maybe just get you to confirm in a sense that even as you're saying, what should not occur, that this doesn't mean that it's a random guess, but that it's a hypothesis based on the science. Because I think a lot of times people, think that, again, we don't have information and we don't have anything to base it on. But when these things are being said, it's based on hypotheses derived from the science.
So we word biologically plausible. So using the science, we can predict, well, what's plausible? What do you think would happen? We've given, not mRNA, but we've given vaccines in pregnancy, such as the Tdap, which is the pertussis vaccine. It's not a live vaccine, and we understand how that works. We give the flu vaccine in pregnancy. So just based on other vaccines that are not live, we don't believe is biologically plausible, just from a scientific perspective, for this to cause any harm to the fetus or to those who are nursing to their baby.
Thank you. We've also had a couple of other questions that are more targeted to, I guess, people with certain pre-existing conditions, that people are concerned about the effect of the vaccine on someone, for instance, who has lupus. We have some questions about sickle cell anemia, sickle cell trait. Were there tests done on those specific conditions to see how the vaccine might impact individuals who already have those conditions?
I can't comment on the non-pregnant population, but for the pregnant population, they weren't included. But those women are at high risk because of immunity. And so we would actually recommend vaccination if that person is, let's say, someone who is working at a grocery store, working at a nursing home, working for the MTA. We would certainly recommend the vaccine in a setting like that with women with pre-existing conditions. What we do know is this: about 61,000 pregnant women contracted COVID between January 2020 and January 2021. And we had about 3.7 million births. So that's a lot of women who can contract COVID in pregnancy. We know that pregnancy does not increase the risk of getting COVID-19, but if you do get it, you have an increased risk of being admitted to an ICU, requiring oxygenation, and also of having stillbirth. So for someone who is pregnant, who's also immunocompromised or has comorbidities, we would certainly recommend the vaccine in that situation, because we know that if you're pregnant and you acquire the COVID-19 infection, there is morbidity associated with it.
Thank you.
So just to add to that, Gareth, what Dr. Altman said, again, The only people who they really say that should not get the vaccine is if you had a severe allergic reaction to the vaccine when you received that first dose, or you have an allergy to the component of the vaccine. Other than that, everyone else can get it. But of course, always speak with your doctor. Someone who has lupus or they're taking a certain kinds of medication that suppress the immune system, the thing is they might take the vaccine and it's just that it mightn't work very well for them, right? But it doesn't mean that it's going to cause them a problem or cause them to die, right? So it's not that you can't take it. It's just that you might have a condition that if you take it, the vaccine just doesn't have any effects. Like some people who have a condition and they're taking prednisone, so their immune system is suppressed. If they take the vaccine, it might not be very effective for them. Okay, so that's why you just want to double check with your doctor if you have some kind of immunosuppressed condition. But again, all the other, they studied a lot of chronic conditions and all these people did well with the vaccine. And as a matter of fact, people who have underlying conditions are the ones we really want to target because they're the one at more of a higher risk for this. Let me just answer this one question that I saw in the chat, and then I want to hear from Dr. Tola, who's going to talk more about mental health, and then we have two other doctors that we want to hear from though. One of the things I just want to touch on, because someone asked, is about the vaccine. I think the Johnson & Johnson one that's coming out, and the AstraZeneca, because you're hearing that in the news. So basically those ones, they didn't show that it's as effective as the Moderna or the Pfizer, but it's still very effective. The flu shot usually is just about anywhere between 30 to 50% effectiveness. So these vaccines are showing that they're more effective than that. We'll take anything that we can get. It's just that these ones, they don't use the mRNA technology. They use the adenovirus as the vector to get into our body. And they, for instance, with the Johnson & Johnson vaccine, they studied 45,000 people. So again, these people are going through trials. So it's not something that they're just throwing on the market. And they're using that small genetic part of the virus for the body to have the immune response. So if you're exposed to COVID, it's going to help to fight it off. Again, it's not 95% effective, but it shows that it would still prevent you from getting severe disease, which is what we don't want. We don't mind getting a little fever, headache, and body aches. What we mind is end up intubated. So if the Johnson & Johnson one is out there and it seemed like it's going to be a little cheaper and it's going to be easier for storage, then go ahead and take that, because we would rather take something that would prevent the severe disease than nothing at all. Okay, so Gareth?
So yes, actually, I just want to, if I could have Dr. Tola hold for one more moment. If Dr. Benjamin is available, because in his bio, we said he would be talking about some of the risk factors, the comorbidities, and just out of that, the previous question, I think that was a very interesting point, that where people are concerned about, how their, quote unquote comorbidities would affect the vaccine, and as you said, rather than it being a barrier to getting the vaccine, they're actually being encouraged to take the vaccine because of these pre-existing conditions that might make them more susceptible. Go ahead.
Yeah, so Dr. Benjamin can talk, if he's still there. Dr. B, are you there? Because he can talk more about diabetes and the chronic condition that causes that increased risk. What do you see in the clinic? And then even Dr. Walters, Kimroy, can join in after that and talk about what he sees in the hospital with those people with chronic conditions.
Thank you.
Good afternoon, everyone. So as the other panelists have shared, COVID is a condition that really heightens your immune response, right? It is an inflammatory condition at the end of the day. So a lot of the symptoms that patients are having are related to the immune response that they are developing as a result of having this disease. So it's a huge inflammation of the lungs, and your damage that's being done to your lungs is done from your immune system attacking your lungs, trying to fight the virus off. Similarly, in your blood vessels and several other organs. So if you consider that you add on conditions, chronic conditions such as diabetes, hypertension, these are also conditions that also increase your baseline inflammatory system. So adding on an additional virus or a response that your body now has to fight with is going to make these conditions far worse. So in the clinics, we see many of our patients, especially our obese patients, tend to have a hard time if they do, God forbid, catch the virus, are more likely to end up in the emergency rooms or having even long-term effects. I have a patient who had the virus last March, and he still suffers from long-term chest pain and shortness of breath. So, even if you are fortunate enough to survive the infection, it is very common for you to have long-term effects. So, in that sense, it is very important that we get that as soon as the virus, the vaccine is available to you, that you reach out to your physician to get vaccinated.
Thank you. Dr. Walters, anything to add to
that?
Yeah,
so just to chime in a little bit on that, I think that the comorbids of diabetes and hypertension, what they do is that they incite a chronic inflammatory state. So if you have diabetes, if you're obese, these conditions have been shown to depress the immune system, that which is able to withstand the virus. So not only are those persons more vulnerable to the virus, but also they're less resilient in terms of making a full recovery if they get the virus. Now, just to make a few points, just so that we all know that there is currently no effective treatment for the virus, okay? There was a drug called remdesivir that we thought would have worked, but the World Health Organization about 2 weeks ago came out with a study that showed that the drug was not effective. What we use now is a steroid called dexamethasone that suppresses the inflammatory response, but it has not been shown to decrease mortality. I've seen patients progress from, in terms of oxygen requirements, from nasal cannula to what is called an OptiFlow, to what is called a bilevel, which is a ventilation that helps to ventilate the lungs, just to keep in a layman's term. And then they progress on to intubation. And, from intubation, your lung damage is so severe that patients just end up coding and passing away. The vaccine is our only hope in terms of regaining what is called a normal state, back to where we were before. The problem with the vaccine, and I don't want to discourage anyone from getting the vaccine, it has to be, if you want to take the vaccine, you have to decide if you want to take the vaccine. But the thing is, the science is new. Whenever a new science comes out, it has to go through a process. Science cannot tell you absolutely that this is going to happen, this is not going to happen. It's all about testing and understanding more about what is happening with the virus. And so, I think that a vaccine is the only hope in terms of regaining a normalcy. They will talk about this thing called herd immunity. And that's what we're trying to achieve here in the United States. We're trying to achieve a state where the amount of persons who are vaccinated are more than the amount of persons who are not vaccinated, so that your chances of getting in contact with somebody who's infectious and not being immune is low. And so that's called herd immunity. Now, the NIH is predicting that we need about 75 to 85% vaccination in order to achieve herd immunity. So far, I think that they have distributed about just under 100 million vaccines, and we are progressing on to see if we can achieve herd immunity. The problem is that there's a race, because we have identified mutations in the antigens of the vaccine. the virus. There is a UK variant which is more infectious. We don't know about the virulence of the strain as yet, and there is also a South African strain. And the problem is that the vaccines that we have now were not curtailed to these new strains. So the goal is to achieve herd immunity before we have all these different strains that would make the vaccine ineffective. So, I think that the comorbids definitely make you less resilient in terms of making a full recovery. And I think that the vaccine is a last-ditch effort in terms of regaining some sense of normalcy back to where we were before.
Thank you. And a couple of things that were just said that I just want to revisit to highlight. Even as you were mentioning there about herd immunity, that's one of these phrases that we had started to hear within the political arena and sort of in the sort of public domain as it related to overcoming the COVID. And it was more so in the sense of we should want people to get COVID so that we can develop herd immunity. And as we see, those who are in, the scientists who understands are recommending, as Brother Kimroy just said, that the vaccine, having a significant percentage of the population vaccinated is the best way to go about achieving herd immunity, not getting the majority of the population sick, especially when, as we heard before, they are not sure about how effective the antibodies developed from a natural antibodies or natural infection are. And so, of course, that wouldn't be the preferred route of getting herd immunity would be for everyone to get sick, but rather for everyone to get vaccinated and prevented from getting sick. The other thing that
Gareth, so Gareth, so everyone on this seminar right now, if they can correct their friends, because you learned it today, herd immunity comes from vaccines, not by everybody trying to get COVID. So tell your friends, you see, you learned something. If it's one thing you learned today, herd immunity comes from everyone getting vaccinated.
Absolutely.
Yeah, I mean, and I may want to just adjust that a little bit because we know that herd immunity can actually occur from natural illness. We don't want it because people die. And that's not what the outcome is about, right? Too many people die from COVID. And, when we saw the Spanish flu, for instance, that's really what happened in the Spanish flu back in 1918. A lot of people died, but herd immunity was achieved. And it's the only reason the Spanish flu actually died down. But in this particular case, this is too serious of an illness. We need to have maximum vaccinations in order to achieve herd immunity through the vaccination process, because the natural illness is too devastating. We've seen that already, and we can't cope with it anymore.
Absolutely. And the other point I wanted to highlight with Dr. Benjamin, again, as he talked about the comorbidities, and I think it's important to sort of emphasize that we see how impactful those pre-existing conditions, those comorbidities are in terms of how the virus will affect you and how much more deadly it can be if you have those comorbidities, which so many of us have one or more of them, versus the fear that one would have about getting the vaccinations with those comorbidities. Again, just emphasizing that it's more recommended that if you do have any of those conditions, because you are at greater risk for severe disease from the virus, that you are being encouraged and advised to get the vaccine. So the comorbidities, of course, are more of a threat for someone getting the virus as opposed to getting vaccinated, that they don't have any impact on whether or not the vaccine will have some adverse effect. And again, if anything I said there wasn't fully accurate, please feel free to correct me. But as our time is running, we do want to get to Dr. Tola, and I believe this is a very important aspect of the whole issue with COVID-19 that in all likelihood, a lot of us are probably overlooking and ignoring, and it's the psychological effects that it can have, both sort of from the physical disease as well. And I hope that you'll be able to speak to us about just, the psychological impact of this pandemic that we're in, and people who have gotten sick and recovered, or people who have maybe even just been peripherally affected and losing loved ones and so on. I know there's just a tremendous psychological cost that many of us aren't really giving much thought to.
Sure. Thank you again for putting this together. And
Thank you.
so as a psychiatrist and mental health specialist, I think the first thing we're seeing with COVID is when you think about mental health, the essence of mental health is actually connectedness. And with COVID and the pandemic, everyone is isolated. So we're sort of withdrawn from each other. And this, of course, has brought a lot of problems we're seeing here. The new statistics with WHO, we were saying like 1 in 5 had a mental health disorder. As of this year, it's 2 to 3 now are coming up with mental health disorders. So what are we seeing? We're seeing more depression. We're seeing anxiety. When you think about a crisis, we're saying that a crisis occurs. How do we correct it? The first thing you do is trying to stabilize and bring back a sense of normalcy. Unfortunately, with the COVID, we haven't been able to do that. It's been going on for almost over a year now. And here we are finding ourselves in the end of January, and we're still dealing with this. Now, we're thankful that we do have the vaccine available to kind of help, begin to direct us in looking towards a sense of stability coming up. So there is light at the end of the tunnel when we think about that. So when you think about stress, from a mental health perspective, everyone has talked about how it affects the body. It's the same thing. So it's a stress, it's some kind of reaction that your body has gone through, and we have hormones that are released at this point in time. We have acute stress, we have eustress, we have chronic stress. There are different types of stress. I'm just going to highlight on the chronic stress because that is kind of where we found ourselves in. So we're not able to restore back to as quickly as, if you had like an acute stress within a week or two, you're able to get back to a sense of, okay, I'm getting better, things are moving on, and that's it. But no, we're finding ourselves in this chronic state where, for instance, you're finding like more irritability, just in terms of how you even respond to different things. You're stuck at home. We're here doing a virtual meeting, and your whole ability of life has been turned around, upside down. And so these are the kind of things that we're seeing. It's affecting your way of life. It's affecting who you are, who you vision for yourself. And yes, some people are prospering in the process, but also some people have suffered, some people have died, and we're going to continue to see that, unfortunately, until we really get through, the vaccines. And so one of the things I want to highlight here is you're going to be, I think it's paying attention to the signs and symptoms of depression, anxiety, because we're seeing an increased rise. Where I work, I'm seeing so many, especially amongst our young adult population, increased depression, increased suicidal ideations, suicidal attempts, anxiety. Everything is double the number. The statistics are just going higher, and we don't even know when it's going to stop. And we're right now still in the pandemic. We talk about the life pre-COVID. We talk about right now we're in that COVID season, and there going to be a life after COVID. So the post mental health effects we're going to be seeing, and we don't even know how bad and the impact of that. We're thinking about post-traumatic stress disorder when we begin to think about that. So if you're finding yourself, maybe you're an easygoing person all of a sudden, and now you're more irritable, your sleep is being affected. You're more losing concentration, angry, just not able to function. You're not even sure what's even going on with you. These are some of the signs and symptoms of persistent state of stress. And this is what, of course, leads after prolonged period of time that would now lead to depression and anxiety. So we're saying here that, with the new data that are coming up here, we're seeing more of this. So if you are impacted in any way, there are ways to, of course, the first thing is if you get the opportunity to get the vaccine, please get it. It's, we've heard from this amazing panelist right here of what we should be doing and how we should encourage one another, and definitely to put a stop to any negative information about the vaccine. And I'm also going to come from the perspective of faith, because as a faith-believing person, I got the vaccine, and I had to do that and I had to show that, look, we say we are believers in the word, let the word work for you. So God has given us wisdom. We say we have diabetes, we have cancer, we have all this, diseases in the world, and there is treatment. God has given man the wisdom to come towards that and bring about, treatment. And so it's the same with the vaccine. Dr. Wiltshire has, expressed, how, even though it was in a short period of time, the reasons behind that. And so if you find yourself getting the opportunity to get the vaccine, go ahead and get it. If you're faith-believing people, and so you kind of want to use the word, let it work for you. If you're saying, and I liked Psalm 91, I think is the most popular verse in the past year that everyone has kind of talked about the most. And so let it become your reality. Don't just say, oh, I know this word, but you're not believing and practicing what you're actually, listening to when you listen to the word of God. And so one of the key things to continue to do, I think, with this pandemic, and not to belabor and stay too long here, is self-care. What can you be doing? We hear it all the time, maintaining and I have like 3 M's. I say mask up, maintain your distance, and definitely by all means make sure you must wash your hands. These are things that we've been hearing over and over again, and I understand that it gets frustrating, and we also kind of get relaxed a little bit, but you really don't want to, because we're seeing the effects of it, the psychological impact, where we haven't even crossed the surface of how much more it's going to affect us. We're looking at our frontliners, how it's going to affect all those in the healthcare industry right now. We're going to see the effect of course, how it's not just financially impacted different businesses. We're seeing the mental aspect as well. And so you guys, whatever you do, just continue to remember, don't get tired. I think we all get tired, like, oh my gosh, when is this over? But don't get tired. Don't get lazy with washing your hands and just putting your mask on and just maintaining distance as much as you can. Part of being in a community here is being able to continue to virtually meet. I know, I think you might have to refer to your state's recommendations for any kind of gathering that you're, if you have to do. But I still say at this point, because of the new variants that are in, and not everyone has received the vaccinations yet, we should not rush to begin gathering and congregating at this point. Let's continue to do that virtual world that we're in right now. I say sleep in, you have to continue to maintain your sleep, eating healthy, dieting, your exercising. We hear that all the time. This doesn't change. These are ways of life that should not change. It should actually improve. And so we should be doing the things we can. I know it's never easy. We're cooked up. We're started, together at home, and it's easy. I typically say that the refrigerator stays open, and so we're kind of going back and forth there. But part of even being healthy, part of even having building a good immunity system, right, to be able to fight any virus or any infection, is also being healthy. And so, Dr. Benjamin talked about the comorbidities with diabetes, with hypertension, and things like that. And so we want to continue to put those in practice as much as we can. Sleep, I say if you don't sleep for 3 days, you will end up in the hospital, because it's vital, it's critical. And so if you're finding yourself having difficulties with that, you want to reach out to your providers, your primary care doctors, begin to speak to them about, what can you be doing, or let them assess you. They might need to evaluate you and say, okay, well, maybe it's time to speak to, a mental health specialist at this point in time. If it's no longer organic, but more mental, that, factors that actually causing this and factors like that. I say, self-compassion. You have to take care of yourself again. Social media break. It is so critical. We are all getting so much information out there, and it's so important to sift through. If you want to focus on your local news channel and the CDC for any information that has to do with COVID, do that. The spread of WhatsApp messages, all the Instagram, all the different things going on. You just really, really want to make sure you're paying attention to all this information, because in it, there's all this negative information of either trying to avoid, getting the vaccine, or coming up with this whole thing about what the vaccine is actually supposed to do. And so I would say, if you're one who, when you listen to the news, you're getting a lot of anxiety, well, maybe you should listen to the news just twice, during the day. Maybe just pick 2 times and say, okay, I'm listening in the morning just to get an overview of what's going on in the world. And then, leave, the evening at night. Again, these are things and ways to try to help you and just sustain your ability to focus, concentrate, and not dwell on the constant, you feel like you're bad. You're like, oh my goodness, what is happening in the world? So much information. So you really want to kind of pay attention to that. Staying connected with family and friends. We can't stress that enough. Even in, the pandemic state, we hear people doing drive-throughs in their neighborhoods, virtual. Here we are in a meeting here, doing the virtual world. And so you just come up with new ideas, creative ways, and how we can all do this together. We're saying, if at the end of this, you've done all of this and you're still experiencing these challenges, because people have lost family members. I've lost family members to COVID. We have workers who we've lost to COVID. So it is real, you know, like everyone has said here, the benefits outweigh the risk. And so when you do get that opportunity, definitely get vaccinated. If you're experiencing any one of this psychological impacts where you're not able to sleep, you're not able to concentrate, memory, you know, just irritability, in terms of depression, suicidal ideations, any one of that, please seek professional help. And I'll put in the chat there, you know, the National Suicide Hotline, you know, you have people that you trust, mental health specialists, therapists, your primary care doctors, reach out to them during times, you know, like this. We're all in this together. And the goal is to know that there is help out there, you know, continue to check up with your doctors, your primary care doctors with whatever medical problems that you do have. You know, they're still saying, doctors are still working. They're still out there trying to make sure that, you know, because of this pandemic, you don't stop taking care of your physical health as well as your mental health. And that's
Thank
it.
you. And maybe if just maybe 30 seconds more, if you can say something. There was a question asked about a child's mental and emotional health. And we know, you know, young people are going through all of this along with us, and you know, they're a bit more, you know, delicate than we are. And they've had to adjust to, you know, the social isolation and everything else that we're dealing with. So can you say something briefly about the children in particular?
Yes, and you can just imagine, I mean, like from last year when I started saying, oh my gosh, you know, proms were canceled, graduation canceled, all the activities that actually keeps a child motivated, the structure in place, everything was gone. Today you're here and you're in, you know, in classroom, then there's hybrid, then there's virtual, you know, it's not healthy for the kids, unfortunately, but what are we going to do? We just all have to adapt to it. And so I think from the role as a parent, what you can do is role model again, even if you're feeling as much stress as you are, maybe you just explaining to them, having them sit down again. They're different ages, bracket ages, I would say, of course, between 3 to 6 or 8. They're still not really sure, just kind of, there are actually really good videos on CDC on how to actually speak to little ones about what is going on COVID, why they can't go over to their friend's house or sleepovers and things like that, what you can be saying to them. And then now when you're thinking about the young adult, you know, the adolescents, I think maybe around like from 12, they are more knowledgeable and they're the ones spending so much time on social media as well. So we want to really limit that as well. We want to limit that from what they're doing. What you can do as, you know, parents again is, you know, limiting the excessive use of the internet, you know, letting them understand what is going on. You know, we are all like reading this, things are unfolding together. Be very intentional about your children, meaning don't just take it face value that I'm okay. You know, how are you doing today? I'm okay. No, like sit down with them. And I know it's hard because we're all, you know, those who are working virtually have to deal with work. The kids are in school doing the virtual work, but you take that extra time. You know, we're saying that we're seeing communities come together, people are spending time together, but also there's still abuse going on in communities with COVID and being isolated and just being withdrawn. Again, the financial impact on the family causes more stress and more irritability, just the dynamics and, you know, just a lot more going on with the kids. So as, you know, someone who is really trying to help their family here is spending more time to kind of just talk it through with them. How are you feeling? What does this mean to you? How are you? You're not being able to go to school, your basketball games, your football, you know, all the, you know, sporting activities that you would do in school that would kind of just motivate you and get you excited. These things are not happening. So talk to them about it. What are the ways that we can just, as a small community, what can we do to kind of, you know, get, you know, make things seem a little more, a tiny little bit normal. You know, these are things you kind of want to do with them, you know, just trying to really explore. So don't just take it at, oh, I'm okay. You know, no, teenagers, we never really know. I am finding like so many more. I mean, I don't deal with, I tell people that, you know, I'm not a child and psychiatrist, but I'm dealing with so many more younger folks, especially our young adults between that 16 to about 25 range bracket there with, and they're coming with severe depression, anxiety, and suicidal attempts. It's gone up. It's just so high. And I'm like, what is going on? And, you know, again, this is something we're seeing. So really want to spend more time with them. Definitely encourage, you know, discourage excessive social media use. Let's get creative. So let's get into the arts. Let's get into, you know, doing different things, reading books, you know, there's still time for creativity at this point in time. And so I think as families, that's, you know, one of the things we can definitely encourage. And again, as if, of course, after you've done all these things and there's still not improvement, it might just be time to seek a mental health professional at this point in time.
Thank you so much. I mean, I think, as I said, I think the psychological, the mental health aspect of it is so important and is so often overlooked. Even many of us may think we're okay, like you said, but even as the world resumes or goes back to normalcy, you know, I've taken to saying that, you know, when we go back to church, there are going to be some empty seats. When we go back to work, to school, there are going to be some empty seats, and you know, we don't know how that's going to affect us at that point in time. So there's a lot of trauma that's happening right now that we're not even really paying attention to. And so, you know, it's good for us to really start thinking about it now and really, you know, reflecting and seeing how this whole pandemic has affected us, even if we weren't directly touched, you know, by the virus. It's definitely taking a toll on our mental health. And so it's good for us to be reminded to be mindful of that. And so I'm just going to give the last word to Dr. Wiltshire, and then we're going to wrap this up. So I'll just pass it over to you.
We're gonna wrap up quickly, but you know, just listening to all of this, and especially ending with what Dr. Tola was talking about, this is why we have to really try to get that end to this pandemic. So this is why we have to try to follow the precautions, you know, that the CDC been put out there. Wear our mask. I mean, I know we want to gather and in all the different arenas, but we have to follow the guidelines. You know, there are churches that are open, there are schools that are open, but they have to do it once they are that they can be sure that it's safe to do so. You know, so you have to make sure that you have everything in place. You have to make sure that you're able to stay 6 feet apart. You have to make sure that you have ways that people are going to have good hygiene there and not share things. So we have to make sure we follow the guidelines. So if everybody's following the guidelines closely, quicker we're going to be able to fight this virus. So we do all of that in addition to the vaccines that are available. You know, we are going to be able to fight this. You know, we were on a good path, and then now all these variants from all the different countries are coming in, and you hear that it's more infectious. It's more transmissible. So one of the ways for us to try to prevent them from spreading is by us continually doing this kind of precaution. So like everyone said, the least amount of things we can do is the basic stuff. Just wear the mask, guys. Don't let your guard down. Try not to go for your large gatherings. Try to do things amongst your immediate family. So far recently, a lot of the infections that we see are from families going to restaurants, having dinners. And everyone seemed like they're okay because they're not showing the symptoms. But remember, you don't have to show symptoms and you can still be positive and pass it on to someone else. And then, you know, you have a family member end up in the ICU. So again, it's a serious disease. The vaccines that are out there, they're there. There have been research. You have people, immunologists, virologists who are studying the data. And many years ago, we didn't have, and I'm just going to be frank, a lot of Black people weren't able to be involved in a lot of these science and these labs. Today is not the case. If you look at the Mrna vaccine, who's one of the head of the trials team that helped to develop the vaccine, this scientist her name is Kiesha Corbett. She's Black, she's female. We are more in the spaces and we're able to make decisions. We're able to say yes, we're able to say no to certain things. Certain barriers aren't there anymore, right? So we have to listen to people who have the experience, who have the knowledge, and we have to try to trust them, you know, because God has given us the opportunity to be in certain places. Where I am now, I'm in charge of many doctors. And I can tell you, like, out of the 70 doctors that are there or the 60 doctors that are there, is probably 2 of them who didn't take the vaccine, and it's just because they're super young and they think that they're going to be okay. But, you know, majority of them took the vaccine. So, and the reason being, because they're trusting the science, they're trusting the scientists, they're trusting the knowledge that God has given us to come up with this kind of stuff, right? So even though we are fearful, let's have more faith over fear and know that, you know, that I don't think that God wants what's worse for us. I think he wants what's best for us, and we have to work together and do the right thing, follow the guidelines, and I think we're going to be okay. I think we're going to be able to beat this, but we just have to have a little patience. Every day it seems like a new variant is coming out, but the scientists are working around the clock to beat that. If it is that we have to get a booster vaccine a year from now or a few months from now, we'll do that. Whatever it takes, just like how everything came, like the Spanish flu and all the smallpox and all the polio and stuff like that. You don't hear about those things anymore because we had vaccines. Those things are of the past. Likewise, this is going to become something that even if and I'm quite sure the coronavirus is going to always still be here, but instead of us having COVID-19 where people are intubated, we're just going to have COVID-19 where it's just like a common cold. So that's our goal. That's what we want. Okay, but we're not going to get there if we continue to spread conspiracy theories or we continue to spread negativity. But, let's try to educate ourselves, ask questions, ask your doctors, speak with people who you trust, and try to get the facts. Okay?
Thank you very much, Veronica. And if there's nothing else that we would take away from this afternoon, or what I would like everyone to take away, is that there are people who are very knowledgeable on the subject, that they're experts, that they have firsthand experience, they understand the science, and they're sharing with us and telling us what the dangers are and where we need to be concerned and where we don't need to be concerned, what things we need to do to keep ourselves safe. Again, as I said at the beginning, there's a lot of misinformation and disinformation that's being spread that can be, quite frankly, deadly. And so it's good for us to be informed, to have a proper understanding of what's going on. It's okay to have questions, and I hope we were able to answer many of the questions that were in your minds today. I know we may not have gotten to everything in the chat, or not everyone might have gotten their questions across, but we hope we have given you enough of a foundation or a base for even maybe allowing you to ask the right questions to your doctors, even as you would move forward with making these decisions for yourself and for your family. So we are really hopeful that, again, you have benefited from this session together. I want to thank all of our panelists, all the doctors, Dr. Wiltshire.
Garrett, one second, because I see Philip is saying to address it publicly. So just one more minute, guys. So for the vaccine, remember they didn't study it in kids. For the Pfizer, the youngest age was 16. So 16 years and over for the Pfizer vaccine, 18 years and older for all the other vaccines, including the Mrna vaccine. They have studies going on now with kids, right? So by the end of the year or so, we should be able to hear data from trials with the vaccine involving kids. So for our kids, they can't get the vaccine right now. So we have to be the ones to help to protect them right now. Okay, so no kids, if you're 16 and over, you can get the Pfizer vaccine. 18 years and older, all the other vaccines that are coming out in the age group that they study were 18 and over. One other question that was there about latex allergy. If you have latex allergy, remember, like Dr. Altman said, many other allergies you can have, you can still take the vaccine. What you have to do if you have latex allergy, when you go to the clinic, just make sure that the gloves they're using don't have latex. But other than that, the vaccine itself, latex is not an issue with the vaccine. Okay, so just make sure, I mean, if the gloves is the latex and so on, you make sure that they use a non-latex gloves. But as far as the vaccine itself, latex is not a problem. I just wanted to make sure, because those are common questions that we have. Sorry, Gareth, you could go ahead.
No problem. Thank you so much. And again, as always, you're encouraged to speak with your doctor, right? You don't necessarily do anything. You don't necessarily want to do anything without the advisement of your personal care, your primary care physician. So please do talk to your doctors and ask them questions specifically. But again, I just want to encourage you that there are answers, there are information based on science, people who are knowledgeable and can really address it. And I don't want us to get caught up in any of the misinformation that gets spread and that causes us to act out of fear instead of out of being informed. So once again, thank you to the panelists, Dr. Wiltshire, Dr. Tola, Dr. Benjamin, Dr. Tyndall, Dr. Altman, Dr. Walters, and Dr. Benn, who I think signed off. Thank you so much, everyone. This really came together in days. They were asked and they immediately said yes because they're passionate about this, and they know how important it is for everyone to be well informed so that they can make right decisions. So I really just want to thank each and every one of you for taking 2 hours out of your busy days. I know you're all front lines working very hard to keep everyone safe, and so we definitely appreciate you, and we're thankful for your passion and your care in wanting to get this information out to each and every one of us. And I do believe it's going to be very helpful for everyone here, as well as their friends and family members who they'll, each one will tell another one, and hopefully we can get the message out. I also want to say for everyone who is listening, some have asked about recording. The recording will be available on our YouTube page, so you can go to the St. Albans Christian Assembly page. So the entire live stream will be there, so you can refer to it if there's any things that you need to sort of revisit to get clarity on. So hopefully it will be a resource for you to be able to answer your questions and maybe the questions of others that as they may ask them of you. So as we started, we want to close out in prayer. I want to ask my brother, Dr. Walters, if you wouldn't mind closing us out in a word of prayer, and then we'll sign off and wish everyone a wonderful evening.
Not a problem, Brother Garrett. I'm happy to always pray.
Amen.
Oh God and Father, we thank you for this place of prayer. We want to thank you for the forum of these doctors who came together to discuss these important matters about this virus situation and this pandemic. Father, we would acknowledge that our times are in your hands. And so we ask you for your help, even in terms of wisdom. Your word says that we should not lean on our own understanding, but we should acknowledge in all the ways so that you would direct our path. And even in the multitude of scientific knowledge and understanding, we acknowledge that science is not absolute. The only absolute on the scene is your word. And so we ask you, Father, for your help as we continue on the scene, that you would grant, the medical professions, the physicians, the knowledge that is meet to counteract even this pandemic. We ask you for your blessing on each and every one who was able to attend. And we ask you for a good evening for us all. We give you thanks in Jesus' name. Amen.
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 Once again, thank you, everyone. Enjoy your evening. Everyone stay safe and stay healthy.